My name is Cora McCorby. I'm the Executive Director of the Minneapolis Public Housing Authority. And to my left and to my right, I'm flanked with our partners and our friends and our co-workers to implement this huge, very important strategy. I'm a former cigarette smoker. A lot of people don't know that. I smoked for almost 25 years of my life. And I love cigarette smoking, but one day I realized that it was a very unhealthy habit to have. Not to mention the expense. I have 4 children, and my 3 oldest children used to take my cigarettes out of my purse and hide them and beg me to quit smoking. And I didn't quit for them. It's a terrible thing. I quit because I just made it up my mind that it was something that I needed to do for myself. So for whatever reason you quit, when you quit, it is a major health accomplishment. Our Board of Commissioners, in its 2012 strategic plan, created one of its major strategies was to create our public housing portfolio smoke-free, our high-rise portfolio. We have 42 high-rise buildings in the city of Minneapolis, and it is our goal by 2017 to have all of those be smoke-free. Currently, we have 7 high-rise buildings that are smoke-free, including these 2 facilities. And by next year, it is our goal to have 20 more added to that list. That is quite an accomplishment. Our goal is to create healthy living environments for all of our residents and to protect them from the dangerous consequences of secondhand smoke. Many of our residents, a great majority of our residents, are elderly and they're disabled, and they suffer from a wide range of disabilities, asthma and other respiratory-related problems. With the funding from the Minneapolis Health Department, we're especially pleased to partner with community organizations to bring smoking classing, cessation classes and supports to the high-rise residents. Smoking-related fires are deadly and extremely costly. The Public Housing Authority, along with other government-run programs, are dealing with serious funding losses and reductions in operating funding. So this is a smart business move also, because it takes a lot more to make units ready for re-rental when you have a resident that has smoked many years in their apartment. I'm really proud of this initiative. I know it's difficult for a lot of our seniors that have smoked all of their lives, but I'm here as a testimony that you can quit smoking, and it takes a decision. You have to really make your mind up that you want to do it, and also the support that's being offered to you. So today
Good morning, my name is Laura Pratt and I'm from the Minneapolis Health Department, and I'm especially excited to be here today celebrating your policy and the positive health effects it will have on the people who live and work in MPHA buildings. Our partnership is part of a larger Hennepin County-wide effort that's funded by the CDC's Community Transformation Grant to increase smoke-free housing for all residents in Hennepin County so that all renters can live smoke-free. It is no small feat to roll this policy out in MPHA's 42 buildings, but in doing so, MPHA is setting an excellent example for landlords across the city to consider and implement smoke-free housing for their tenants as well. I'm especially happy to be here today on Great American Smokeout Day because I'm proud of the partnerships that the Health Department has developed to help MPHA residents quit smoking if and when they're ready. There are many great resources in our state, from Quit Plan Minnesota to the services that healthcare providers offer in their own clinics. But not everybody can access these services because they don't know about them. There's language or transportation barriers. And so at the Health Department, we wanted to make sure that MPHA residents get the information and support that they need.
Pacolia Perkins is a resident here at 5th Avenue.
Good morning.
Good morning.
I just want to begin to say I have been a considerate cigarette smoker for some time now. I have resisted quietly but not apologetically for my actions. Non-smokers give a look of really, when will you stop smoking? Then there are hardcore non-smokers that will 12-step you up to giving up. I could stand here and recite family cancer stories, but I will not do that today. Quitting is hard and may be difficult, but the reason is to stop for you and you only. Our bodies were not meant to be hardwired for cigarettes over time. It breaks down everything you need to require breathing and sustaining life within us. It affects the respiratory system from your skin, cardio, skeleton, muscle, nervous, urinary, and reproductive systems. Quitting is the first step to healing. Thank you.
My goal, and it's the PHA's goal, that every one of our residents will have a similar testimony. Really explaining in there and rationalizing in their own heart and mind why they decided to give up the bad habit. Because it is a bad habit besides being a deadly habit. I'm so happy that you all were here today with us to hear from our residents, hear my confession about smoking, and my love for smoking. I don't understand what we're like that as humans, but we are. But I know that I will never smoke again. And I believe that when we implement this program, its full implementation would be the end of 2017, that we will have full compliance with our residents. Thank you very much.
All right.